try and touch both feet and let me know at what point you start feeling aches and pains.
Oh,
right about there.
there.
Okay, gotcha.
Yeah.
And let me have you extend for me. So you're gonna go backward.
That one I don't.
That one,
yeah.
extending.
No.
All right. And let's bring that back again. That's uncomfortable and sore as well.
Yeah, and not a lot of strength.
Not a lot of
stuff.
Okay. All right. You can cross your arm. L5S1.
Yes.
This area here. Right. That's the area that's having the issue.
And this is how they're supposed to look, obviously,
that's
where the
that's
discs are, you know, there.
Right.
And then here, this one's almost
right. It's thinning out.
deplenished
right.
completely.
So it's degenerating. Yeah. Hi, I'm Dr. Clerge, and I'm a chiropractor, and I'm here with this young lady today. And so basically you've been having some issues: neck, mid back, lower back, legs, right? Well, first of all, tell us about your dog. You have a service dog, right?
Oh, this is actually my best friend's dog. She's had her for 5 years. She's a certified registered ES dog. She's just the sweetest little thing. She really helps. My best friend and I both suffer from trauma, and we deal with depression, anxiety really bad, and she is just the sweetest thing. Like, if you're crying, she'll literally lick the tears off your face. She's so adorable. And her name is Cheyenne. Say hi, Cheyenne. Say hi to mommy. Hi, mommy.
All right, so tell me about your issues. So what's going on?
Well, I was a very excessive worker in my younger years. I wasn't fortunate to have a lot of things, so I worked a lot. I did about 2 or 3 jobs at a time usually, and apparently it just put a lot of strain on my back. I just recently found out about 1.5 years ago, I want to say, that I suffer from a deteriorated disc, which causes me another issue with pinching on my left sciatic nerve, and that runs the pain all the way down into my left leg, which is also not any fun because I've had 2 knee surgeries on that leg as well. But it bothers me a lot. It's really numbing. It's paralyzing even at times. Very hard to move, very hard to get up out of the bed. But you know, you do the best you can. I try to do as much therapy on it as I can, but it's really a consistent issue that I deal with.
Okay.
Very painful, very disturbing.
Gotcha. And you said you had the x-rays, you had it on your phone, right?
I did.
The last x-ray that you...
Yes,
yeah.
I actually have it right over there.
Right.
I had not a chiropractor, but an orthopedic who actually performed my back surgeries as well. Not my back surgery, but my right shoulder surgery and both of my knee surgeries. Okay. And he referred me over to another orthopedic at Master Washington Hospital Center, and that's when he performed the x-rays. The treatments that I have for it is very limited. I don't have a lot of options surgery-wise. There's either a pain control resolution or surgery that would limit a lot of my mobility, so I don't have a lot of options there. My best bet is to rehabilitate it the best way possible that I can.
Gotcha. All right, so let's zoom in on the x-rays. Basically, this is where I see the L5S1.
Yes.
This area here. Right. That's the area that's having the issue.
And this is how they're supposed to look, obviously, where the discs are, you know, there. And then here, this one's almost deplenished completely.
Right, so it's degenerating. Scroll to the next view for me.
This one's similar.
Okay.
It's a bit clearer.
Right,
you
same
can see
thing.
it a bit better.
All right, so keep scrolling.
And then I have one where they had me bend over a bit more to kind of see, and you really almost can't see it at all there.
Okay.
Yeah.
All right.
And then they got a front view of it where also same thing.
Same
you really
thing.
can barely even see it at all because it's
Gotcha.
almost gone.
Okay, so let me explain it to you. We have a chart that kind of explains
Okay.
the lumbar views. So basically, with your lumbars, it starts at L5. A small percentage of the population, you know, they have L6, but the majority of people, it stops at L5.
Okay.
Right? So this is the sacrum area, and this is the area where you're having the issue, the L5, S1. Okay, so this is L5, L4, L3, L2. But this particular area, you see how the space is supposed to have a nice space in between? Where yours, the disc is starting to thin out, so it's degenerating. So this is like a phase 1 degeneration. So you're in phase 2, phase 3. Okay, as you can see, if you compare the two spaces right here to this space, you see the difference in space. So that's what's happening.
Okay.
And usually with that, you know, degeneration, you'll start having some of the symptoms that you're experiencing, you know, shooting pain, numbness, and so forth. And depending on the severity of it, oftentimes they'll suggest surgery, like in your case. With chiropractic care, it does help. However, it depends on the level, you know, it depends on what phase you're in. So chiropractic care can provide some relief if it's not a very severe case. But you're mainly this phase 2. That's where you're at right now.
Yeah, that's exactly right. Because it almost looks identical to mine.
Right, exactly, exactly. So we'll get some work done and then let's see what's what. Okay.
Okay.
All right.
Great.
Okay.
All right. Thank you.
All right. So basically, we went over the X-rays, and you know, mainly the degeneration is in the L5, S1 level, and because of the level of degeneration, you know, there's a limited amount of things that we can do, because once we can't really bring the disc back, basically,
of course,
you know. So that's why most of the time they'll suggest surgeries, infusions, and so forth. Okay, so that's why we usually tell people to come in and get chiropractic treatment so they can keep their range of motion and keep their mobility at a stable level. You know, so really chiropractic care is mainly preventive. You know, although it does help as far as, you know, when you're having your aches and pains and so forth. So today we're going to do a few things to kind of assess and see what's going on. All right. And then we'll do some chiropractic adjustment for your whole spine, neck, mid back, lower back. Okay. And then we'll put you on different types of treatments, like massage to kind of help with the muscles. What we want to do is prevent you from having surgery, you know, but like I said, it's at a very severe phase right now, so we'll see what can be done. All right. We're gonna check your range of motion first, you know, to see what creates pain, what type of movements are uncomfortable, and so forth. All right. So let me have you stand right here for me. All right. So I'm gonna have you bend forward, try and touch both feet, and let me know at what point you start feeling aches and pains. Right about there. Okay. Gotcha. Yeah. You feel anything shooting down, like for example, like any radiating pain down the leg or anything like that?
It's more of like a strain.
Gotcha. Come on back up. Come on back up. All right. So let me have you go side to side and let me know if you feel any aches and pains or any radiating. Or just so you're gonna go this way and that way. Yeah, that hurts there. That's as far as you go with that. Okay. And let's go to the other side. That's as far as that actually feels good.
For the other side.
Gotcha. All right. Let me have you put both arms up, and you're going to rotate.
No, that one will aggravate it. Yeah, a little bit.
Okay. And let's go to the other side.
Same thing. It relieves a little.
It relieves it when you go to the right side. Yeah. I see. Okay. All right. And let me have you extend for me. So you're gonna go backward.
That one I don't.
That one extending.
No.
All right. Okay.
That will actually hurt severely. Like it'll.
When you extend.
Lock up. Like it'll hurt so bad it'll lock me up for a second if I happen to. Which will mainly just happen to me. Like say I'm walking and you know how you don't notice maybe like one step. So you step down too hard as if you were going to take a normal step. That. It seems like I feel them hitting together since the disc isn't there. That's what it kind of feels like, and it's very, very painful.
Okay. All right. Okay. All right. Have a seat. So the neck and upper back is not they're not too bad, right?
Not at all.
It's mainly the lower.
Yeah, any pain I may get in my upper back will just like kind of be a little crampy pains if I'm laying a certain way or whatnot.
Gotcha.
But not as bad as my lower at all.
All right. Let me have you kind of extend a little bit. I know extension is uncomfortable for you. Is that tight in the mid back?
Yeah.
Yeah. Okay. All right. Okay, that's uncomfortable. All right. Now let me have you bend forward. How's that?
I don't have much strength there.
Okay. All right. Let me have you go backwards. All right. That's still uncomfortable, right?
Yeah.
All right.
It's like pressure.
So I'm gonna add a rotation component to it. So I'm gonna have you cross your arm like this, woman, and then I'm gonna rotate you and then bring you back, and then let me know if you feel any relief or if you feel, aggravation. That's uncomfortable because you're resisting me. So all right, okay. And let's rotate this way. And let's bring that back again. That's uncomfortable and sore as well.
Yeah, and not a lot of strength to hold myself up.
Okay, all right, you can cross your arm. And let me know when it gets tight. That way I don't go too far. I can feel you resisting already. You don't stretch often.
I don't stretch much.
Yeah, because you should be able to go.
Yeah, a little further than that. Yeah.
Since we don't want to cause you more pain, so we won't do too much. All right, let's go to the other side and do the same thing. All right. So it's very important to stretch, especially with what you have going on. I see stretch in the morning, stretch in the evening as well.
But I noticed if I'm laying flatter, I can actually get it back further than that.
I see.
A little. The left one's actually more used to getting stretched, obviously, because of the therapy on it.
Right.
And I guess I neglect the right one.
Right, yeah, nah. Alright, good. How does that feel?
That actually feels good.
That feels pretty good? Alright, good. I'm trying not to go too far, because I know it's uncomfortable. Okay, how's that?
Oh, that feels great.
Feels pretty good. Okay, good. All right. And we're going to this. Same thing with the other side. How's that? This side is tighter?
Yeah. I completely neglect my right side.
Yeah, stretching is very important. Relax. Good. Alright, so I'm gonna go higher. How's that? That's uncomfortable.
Right on the spot.
On the spot where you having the issue. Yeah. Another way to do this, like if I lift this leg like this, take a towel and wrap it around your ankle, and basically you're gonna pull back.
Pull it back.
Yeah, pull the towel back.
I think they showed me that in therapy.
Yeah. That helps a whole lot. There you go. Good. All right. Up. Good. And go ahead and go back. There you go. Where do you feel it? In the area where you're having it? Yeah. Okay. Bring this up. How's that?
That's good.
That's good? Okay. So obviously one side is worse.
Yeah.
Alright. And let's bring this down. Okay, so same thing, I have you bend your leg. This way. That's good. This leg is gonna come up. And we're gonna bring it as far as we can. Good. How's that? That feels good? Okay. I'm trying to stretch this area. When it gets uncomfortable, let me know, okay? Right here? What about that point? Okay. Side. Okay. That's uncomfortable.
I have a little screw in there now, and I had to name him because he's a part of me. So that's my little homie Scrooge.
So you named the screw.
I named the screw Scrooge. That's my little homie Scrooge in there.
I got you.
Holding me down.
Whatever works for you, you know.
Right. I had to come to terms with a little piece of metal being in my body.
Right,
So that's
right.
how I did it.
Right. Okay, now how's this stretch? Is that okay?
That feels great.
Feels pretty good.
Mm-hmm.
Okay, perfect. All right, so now we're gonna go ahead and get you started on the adjustments, okay?
Okay.
All right. So we're gonna go ahead and do your cervical adjustment for your neck, okay? So relax.
Yeah, I feel a little nervous, but
You'll be all right.
I'm a G, I can handle it.
All right, good. Relax. Good. Good. All right. Good.
Wow.
All right, come on up. Let's see how that feels. Good. Move your neck around. Let me know how that feels.
That feels great. I'm even just saying it. It feels great. I've been so stressed. Wow. That's all it took?
Feels amazing, right?
But don't try it at home.
Right, yeah. So they gotta be licensed.
Leave it to the professional.
Perfect, perfect.
Yeah.
Okay, so now I'm gonna have you on your stomach.
Okay.
Let me take this away. I'm gonna put both hands here. And have you slide down for me just a little bit. There you go, perfect. Good. All right. Is that comfortable for you?
Mm-hmm.
All right. So what I want you to do is relax for me, okay? All right. So I want you to relax, okay? Good. Okay, perfect. All right, let's go to the other side, do the same thing. Relax. Good. Okay. All right. All right. Come on back up for me.
Uh-oh.
It's okay. I'll fix that. Yeah. Let me help you up there.
Ooh.
Okay. All right. So neck, upper thoracic spine. Just kind of like move around again. Let's see how you feel. All right.
Feels a loose.
Right.
Yeah.
More range of motion, right? Okay. All right. Now for the mid back area. So there are several ways to adjust the mid back. One of them is you crush your shoulder and then apply pressure. Because you had the shoulder surgery, I'm gonna skip doing it that way.
Okay.
So I'm gonna do it a different way. So once again, I'm gonna have you on your stomach.
Okay.
All right. Okay. Yep. Take a deep breath for me and blow it out. Out. Good. Again, deep breath. Out. Good. One more time. Out. Good. Okay. Perfect. All right. So now for the problem area, which is the lower back area. Okay. Come on up. Actually, come to this side. Come on my side.
My right side.
Yeah. All right. So I'm gonna fix you up. I'm gonna bring you close to the end of the table. Keep coming. Keep coming. There you go. Good. I'm gonna twist you up a little bit. Good. And gonna bring your shoulder right here. So keep coming closer to the end of the table. Keep coming. Good. You won't fall off, so don't worry.
Okay.
All right. Good. All right. Just relax as much as you can, okay?
Okay.
Good. Relax, relax. Relax, 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 relax. Oh, there you go. Felt it, right?
Yeah.
Yeah. Oh, one more time. There you go.
Ooh. Oh, wow.
Wow. You got all kinds of movements now that you didn't have before, right?
I know, when you heard that.
Yep.
I'm like, oh, wait. Oh,
Yep, there you go.
yeah, that felt great.
It's like instant.
Yeah.
No. Let's go to the other side.
Okay.
Let's check that out. Alright. Come closer to me.
Oh, yes.
There you go. Perfect. Alright. Both legs straight for now. And I'm going to bend this leg and go all the way. There you go. Good. Good. So I want you to relax. There you go. Perfect. Yep. That's it. You felt that, right? Yep.
Yeah. I already feel so much less stress.
Okay.
Like
Let's have you move around for me. So stand up. Let's have you move around. Tell me how you feel.
How Auntie look shy. Feel good.
Yeah. So that's much better, right? Yeah.
That's a lot better. Wow. I feel even a tiny bit more strength in my core.
Right.
Obviously not. I don't think the strength is going to build up now, but it's allowing me to be it, because one of the reasons I don't do a lot of core exercise because it's extremely hard. It's painful. I don't even have the motion, or just the strength to try to sit there to start the process of it. This is at least allowing me, to move a little bit better, and
Let's go side to side.
Awesome.
Now. Remember, side to side was a bit uncomfortable, so let's try going side to side and see how that is. All right. So you're moving a little bit better. Still a little tight, but it's better than before, right? Yeah. Good. Now the main one was extension. So when you went backwards, it was uncomfortable. So let's just try it. Oh. Okay. How's that? A little bit better.
It's a bit more tolerable.
Gotcha.
Yeah.
Okay, perfect. All right. So, can I have a seat?
Thank you.
So basically the way the chiropractic adjustment works, right? We put more motion into that segment, especially the lower back. That's where you had most of your issues, right? So after the adjustment, you can see that you have instant improvement in your range of motion. But that doesn't mean that it won't come back, right? You're right. So that's why we recommend several treatments, and then we decrease the frequency of treatment. Okay. So now what we're gonna do, we're gonna get you on some massage to kind of help release some of the muscle tension, and then we'll get you on the traction table. Okay. All right.
There was a lot of tension in my back neck area, a lot of it, and honestly it's all gone.
That's good.
It's really all gone now. It's been very tight. And I try to sit at home and massage it with some rubbing alcohol, thinking that'll help loosen it up, but it doesn't really work as well as I now see it should.
Trying your own home remedy, I guess, huh?
My grandmother told me that, a little rubbing alcohol, and then, you know, I'll follow it like a little icy hot or something.
Well, icy hot does help as far as, you know, decreasing the muscle aches.
That's temporary.
Right, that's true. We're gonna put the stems in the mid and lower back.
Okay.
For you.
One here, one here, one here, one here.
Cold.
They were warm.
It's cold on me.
Hold on 1 second.
Like right there is fine?
Yes, thank you.
And have your leg straight from your back.
Thank you.
Is it comfortable?
Yes, thank you.
Now, tell me when to stop.
Yeah, that feels good. Thank you.
One more.
That's good. Yes, that's perfect. Thank you. Oh, I wasn't expecting that.
How do you feel?
I feel really good. Yeah.
So you had your adjustments, had the massage. Now we putting you on some stems and the roller table, which is kind of like intersegmental traction. So you should feel like new.
I do. I feel less stressed. I feel more mobility. I feel a lot less pressure. In spots, particularly around my neck and on the left side that I usually feel a lot of pressure and stiffness. It's a lot looser, it's a lot less pressure, and I'm able to expand. It feels like my muscles are expanding a bit more than what they usually would, and again, just 10 times less stress.
Okay. Right.
I feel great. Yeah.
Perfect.
Thank you.
No problem. You got it.